Dr. Nitika, now we know that every cell, every feeling and thought creates hormones. And we know that the nurturing of the baby in womb is really important, and we do not have to treat those 9 months as a grace period before the job of actual parenting begins. Yes. Now, the next philosophy which we would like to discuss with you is how a mother can actually emotionally and mentally and as well as physically prepare for motherhood. There are a lot of many changes that comes in a woman's body when she is, under this phase. So how she can cope up with that physically as well as emotionally?
Yeah, it's very important actually. First and foremost, as I told you, when we give knowledge to the mother, why is this happening to you? That actually takes away a lot of pain because of that change which she is undergoing. For example, I'll just share with you, there is a lot of nausea and vomiting which a female will have in 3 months, at least 80%, 70 to 80% will have. So they start fighting with that feeling, of getting upset. They are vomiting 5 to 6 times in a day, night they eat food and they vomit. One problem is that they vomit, and the second problem is that after each vomit, they will create lot of stress and anxiety in their body, that whatever I ate is all out. Now how will I manage? What will I do? These 10 questions, entire family is entangled. The husband in the office will get a call. They come to our clinics and they are absolutely confused. Then we admit them, we give them drip, and just admitting them, I would say about 50% will not have vomiting after admission. Why? Because the stress and anxiety will settle. The vomiting part, because of the hormones, will continue.
Right.
It's not that they are making up. They are having so much of discomfort, but nobody tells them why are they having so much of discomfort. Because this body is making so much of hormone, and that hormone which is secreted in your body is actually making the organs and the organ systems of the baby. So that cannot lessen. See, it's very important to know that first 11 weeks, which is the first trimester, actually the total pregnancy is 40 weeks. Gestation being 280 days, 40 weeks, or 9 months and 7 days. And for our convenience, in the medical terminology, we divide it into trimesters, 3 months each, because each trimester has its own few characteristic features of symptoms, of signs which a patient goes through, and of the treatment and the management modalities which each trimester has. Like for the first trimester, we have a few set of signs and symptoms which the patient undergoes. She is uncomfortable because of, for example, nausea and vomiting. She may have constipation. She may be very tired, very sleepy. So we know this. These are the few things which a patient will have. And then once the patient is having this, we try to connect it, tell them, give them knowledge that this is the reason why you're having them. So at least emotionally we make them stronger, so they become more accepting and they have more power now to face it. See, even if they're taking the medicine, most of them, they will not take the medicine. In spite of the fact that we write, they don't take. No, it may harm my baby. So it's very clearly, when you are writing a medicine on a prescription, we tell them that this is a safe medication that you take if you need. Because if you are vomiting and if you are stressed and anxious after vomiting, then that stress and anxiety is giving more harm to your baby than this small little tablet. So please take this tablet in your hand, give it a lot of good vibration and then take the tablet so that it heals you better. So if you make them understand like this, they will always be very compliant. Because doctors today, we as doctors have this problem that they are not very compliant. They don't follow instructions clearly. Especially for giving them a medicine, because they feel medicine may harm. In non-pregnant conditions, they will take the medicine. But in pregnancy, they are not too comfortable with that. So it's very important to counsel them properly. So those physical changes, we will be able to tackle once with the knowledge that why are we having those physical changes. Secondly, making them understand again that they are temporary, please. Permanently, you are not going to keep vomiting and having nausea. You're not going to keep feeling tired and be so sleepy. It's all going to keep changing because after all you are growing a human body within. From one little cell we are making a full human baby in 9 months. I don't think we can have a project bigger than this. It's a lifetime project because you're going to take care of that baby for the entire life as well. No? You're going to be connected with that. So it's very important that be very, very cautious, be very clear of what all you are doing, creating, and how you're going to go through this journey of motherhood.
It's really beautiful. It is always very beautiful to encounter such things, that creating such a life in yourself is a blessing for a lady. But why this is taken as a very stressful thing, and what exactly do you mean when you say that you have to put good intention while taking in a tablet or while even eating something? How can we give intentions to such things?
See, it's very simple. As I said, it's a very beautiful process, but it's stressful. Why, as you asked? Because we are concerned. Every mother, would-be mother and father, they are very concerned that their baby should be very healthy. And that's a very genuine concern. That is why they're coming to us as physicians in the best of facility, where they want to secure the pregnancy totally. Because, and once they come and they are listening to us, it's like, it's a word for them. Whatever we say, they feel it's very correct. And that's going to help their baby only, no? And why I say with medicines, because there are certain medicines which they will definitely take, but this is medicines for their own problems, which they are having as little side effects of pregnancy. So as these side effects of pregnancy, if they are having, those they will avoid. So when I say, when you are taking a medicine, if you are having a headache, you say, oh God, now again I am having a headache.
But even taking a medicine becomes a kind of a matter of stress for them, that I have to take this medicine. So will it be
that
beneficial
is that
for
once
me
they
or
keep on
not?
coming and they keep on talking to us, then it's relieved. Because many of them have not taken any medicines till the time they are pregnant. They never know the concept of having a vitamin tablet daily. They are generally in their 20s, early 20s or early 30s. So there is no need for them to take any tablet or medicines. So we just have to keep counseling them that they are vitamins, they are supplements which are helping you create a perfect life within. So you need to take this, because your diet, however nutritious and good it can be, still you need certain vitamins, because a lot of research has been done. Once we say that you need this tablet, like I'll tell you, it's a very common tablet. It's available by the name of Folvite, which is folic acid here, and it's available by the name of prenatal, even in the abroad. Now we have a very huge study which is stating that you need to take 5 milligram of this tablet every day to prevent certain defects in the spine which the baby can have. There is a condition which is known as neural tube defects. The spine can have certain defects. So this is a medical fact. Now we know, all of us know, it's being taken all through the world. Everybody is giving it. So once they have the knowledge that it's not a medicine, it's a supplement which is going to make my pregnancy safer, my baby healthier, they will take it. But you need to give knowledge. We as doctors need to tell them. Every mind needs an answer, as I told you. Every mind is creating a question, and we as physicians need to answer it. So this is a platform where it becomes easier for us to answer and reach out to many people.